Welcome to Healing Beyond the Trauma. My name is Megan Alves. I'm a licensed clinical social worker. And this podcast, I want to break the stigma around mental health and have real, unfiltered conversations about healing. Some stories are going to be raw, even triggering at times, but they're real and they're honest because healing starts with honesty. If you've ever felt overwhelmed, stuck, or like you're carrying it all, you're not. Here, you're going to gain validation, practical tools, and a new perspective to move forward. Because healing isn't about erasing the past. It's about reclaiming your future. So let's dive in. Yes. Hi, and welcome back to another episode of Summit to Healing. Today, I have an expert with us, and I'm super excited to talk about a bit of a sensitive subject, but this sensitive subject is, we're here to answer some questions that were asked about divorce. And I have now Dr. Donna Wilburn. Congratulations. If you guys heard our excitement in the beginning, it's because we know it's a long road to become a therapist in general. She's a licensed marriage and family therapist, and she went back for her doctorate. And so she's just been in school forever. And so I'm super excited that you've finished that up. So I am going to let you introduce yourself. Tell us about yourself. Tell us how you started this journey. And please don't forget to fill us in on why you decided to go down with your expertise for high conflict divorce. Welcome.
So I've been doing this about 25 years now, and I remember when I was first starting, I think I got one of these high conflict custody cases when I was maybe just an intern. And I primarily worked with children, and I was really noticing how stressed the children were, and so I took it upon myself to involve the parents and educate the parents on how to better communicate or what to say and not to say around the kids. And it turns out that that's a whole niche. So I found out that working with high conflict custody cases is a specific specialization, and I liked working with that dynamic. So then I started getting trained in working with that dynamic. And so for the past 25 years, as a therapist, how you have to get continuing education credits. So every
Yes.
year I get more training, every year I get more training. So 25 years into it ends up with a lot of training about working with this particular niche. I notice that not a lot of therapists want to work with this dynamic. This population, this high conflict custody case type population, is almost hostile. Like
Yeah,
I
it
say, they
can
either
be.
hate you or they love you. So you will come across a lot of people who think you're awesome, like, oh, thank you so much for saving our family. But then there's some who, I hate you, you ruined children, and they've made threats. I don't know if it's because I'm so old or my autism spectrum that doesn't seem to care if they hate. so so I was like, well, that's on you if you want to hate on me. I know what I'm doing is good. So I'm just going to keep doing what I'm doing. And I think
Good
that
for you.
yeah, I think that immunity kind of to haters allowed me to continue to evolve and grow in this niche. And so as let me tell you my dissertation as getting my doctorate like 4 years ago or something is a training manual for working with high conflict cases. Like that's how focused I am on like providing the best and training others to be able to do this what I do.
Yeah. And I love that. I will link everything in the show notes for those of you tuning in as I'll share her website. And there's actually a part, Dr. Donna, that in your website there's training courses in there, correct?
Right.
I,
There
I
there are
yeah.
some, and I have some that are like videoed courses, and there are also the AFCC is what it's called, is a organization that specifically focuses on this population. They have so many opportunities for training.
Perfect. And I love that. And that was something, as a licensed clinical social worker and Dr. Donna is a licensed marriage and family therapist. This was something I remember being when I was even as an intern. Oftentimes, they ask therapists for the real world out there, what's your specialty? What's your niche? And as a baby therapist, you're trying to get your legs. We're literally like deer out there on ice. We're like, let me figure it out. Everything seems scary, everything's big. And, I knew right away, even working in, the children's unit in psychiatric hospitals that and doing family therapy sessions before discharge, I was like, this is rough. Like there's just so many layers to high conflict, and then you add mental health on top of it. Loved it, but that was when I realized I loved trauma. And so we're both definitely in these specialty areas that we continue to get trained. But I want to go back to how you said, I don't know if it's because, now I'm older and I've been in this field for a while. And if somebody doesn't like me and thinks, you know, I I want to highlight the fact that when you find a passion for doing the hard things, it really does show, because as therapists, and for those of you looking for a therapist, you're going to know when we're passionate about something. And and those therapists who really do love the hard stuff that people are like, "Oh, I don't know how you do this. I don't know what why you would choose this niche." But when you stay on this track, and now after 20 plus years of doing this work, and yeah, you have those that you're going to help, and then you have those that they don't like the decision that you've made or the direction that you're taking, whatever it may be. Let me ask you, as you have held this passion, obviously, because you're still standing here with a smile, as therapist burnout rate is a real thing, y'all. How and what has maintained your ability to stay within this niche in the long run?
I have to say, and I'm sure you've come across this, it's the ones who everything goes great. And you're like, this is why I do what I do. So it's the parent who hasn't seen their child in years, who gets reunified with their baby, and their child is like thrilled and they're crying and they're so happy. So those moments, it's I am super protective of kids. And so it'll be kids in a messy, psychologically abusive dynamic that I'm able to get them out of that dynamic into a healthy place. And then they come back years later and they tell me, thank you. Like I couldn't have done it. I was, I didn't even know what was going on. And I never would have interacted with that parent if you didn't step in. So it's
Yeah.
the ones that come back that talk to you later, that share like, thank goodness you did that. It's the ones that you get to see the peak culmination of your work, and that gratification, like, which doesn't happen all the time. It's
Right.
like, what, one out of like 60 cases or something, but
Yeah.
that gratification for that child's life, like knowing that they have a chance now, is so motivating that I do deal with all the haters and the, you know, nasty stuff out there for that group.
Yeah. And I commend you for that, because I mean, 1 in 60 is probably pretty darn accurate, right? As anyone who has gone to therapy, or if you've thought about therapy, therapists really, for the most part, right? Dr. Donna and I can attest to this, is that most therapists out there are really trying to do the best that they can with the tools that they have, and they do want to do well for you. And this kind of leads me into a question for you. When you think about finding a therapist, or maybe you're contemplating divorce, maybe you're not even sure where to start with divorce, let's kind of start in the early stages, because we know oftentimes that those that come to us in high conflict divorce, they've waited a minute, and it can be messy and some things can happen. Let's talk to those that could be struggling in those early stages, and let's talk about some of the stigmas that come with thinking about divorce, especially when kids are involved. What kind of, I guess, tips or insight would you give those that might be struggling in that middle right now of like, where do I even start?
And I have people that have come to me prior to even taking that step of separating, which I commend, right? If you're even considering that, reaching out for professional help and to get clarification, I think is amazing to me. Okay.
Yeah.
So in that situation, let's say I'll have somebody reach out because they think that's the direction that they're going in, and they want to know how to prepare their children, how to present the information, how to handle the separation, how to separate, how to involve the kids, what to say to them, what's appropriate, what's not appropriate. So even before even separating, if if especially both parents think they're aiming in that direction, you reach out and get help prior to the separating, because how
Yeah.
you start off this process sets the stage for how these kids are going to handle it as you go. Okay. And so, to me, if you're even contemplating it, reach out to a therapist and talk to them. Usually, like a couples therapist or someone who has some training with family dynamics and family systems, like someone who, and you can ask any therapist for their curriculum vitae or their training, like they should be able to provide it. Look and see, do they have
Yes.
training in this? Because that's important, okay? You
Yeah.
wouldn't
Make
go to
sure that
a
they're a specialist in
Mhm.
that area.
You wouldn't go to
Yeah.
even a car mechanic unless they had something on their wall that says, I learned how to do this." So don't go to a therapist and go like, "I hope they know how to do this." You, like, ask them if they know if they have any training. Some have, some haven't. You are
Yeah.
allowed to ask us, okay?
Yes.
You
Yeah.
are
You're
allowed.
hiring us. We
Right.
want to support you through it. Yes.
Get a consultation, talk to them about, like, do you have training? What kind of training? Are you specially trained? Whatever. Like, ask around or ask other therapists we know who's trained and not trained or who specializes in things. Like, we talk to each other, we communicate. So I would say find someone who knows how to work this, who knows how to work divorce, who knows how to help your children and you with the whole planning and the system of it. I get a lot of folks coming in who it's pre-contemplation, right? They're not even there yet, and they
Hmm.
have big fears of divorce is going to ruin my children. Divorce is going to be traumatic for my children. And they come in like that, and there's no research to support that. Divorce is not traumatic for anybody.
Mm.
It's the how you handle divorce that can be traumatizing for children and adults. Okay. So when you're going, oh, we're going to possibly get a divorce, I don't want to traumatize my children. I'm like, that doesn't traumatize your children. That divorce can actually be like beneficial in that your children, if you have conflict in the home or an unhealthy relationship or whatever, and you think, oh, we just have to stay together for the kids, you're role modeling to them. You're creating a template for them about what to expect in relationships. And so if
Mm.
they see your unhealthy relationship and they're like, I guess that's how relationships go, then you're setting them up for that kind of relationship in the future.
Mm.
They'll automatically fall into that kind of relationship. So looking at your relationship, you're like, is this what you want your children to have? Is this what you're role modeling? The ideal, like, yay, I'll be so happy if my children have a relationship just like this.
Yeah.
Because if
And you've
that's
said,
what you're showing them, that's what they'll have.
yeah, and you've said so many important things that I want to make sure to highlight on is that divorce in and of itself could actually not be the traumatizing part when we think about the stigmas of divorce. Oftentimes, it's that simply divorce is going to traumatize your kids. Sure, it could happen, but the real asterisk here is how you handle it is what could be the deciding factor of that situation being traumatic. Correct? Yes.
And you,
And
as a
so,
trauma therapist, like you say, you work with trauma, and what they're showing now with trauma is it's not the event that was traumatizing, it's the lack of support, it's the lack of connection, it's how the trauma was handled.
Right. Our
Causes
perception
trauma.
of the trauma, which takes all those layers that you're just
Right,
mentioning, right? Like
right,
when we think of the definition, I think that this is why the definition of trauma is a bit vague
right.
because it really is the perception of a life and death situation or, the bully situation. Like we can really categorize it in big ways. And so if we think about this to break that stigma of that trauma in and of itself, is really if this is something on my plate, how do I make it better in a tough situation? It's not going to be easy, right? Like the situation's going to be hard. It's a big change that can happen for kids and for the adults as well. The families involved, like there are all those layers and that's understandably hard. And then, the change that comes after that. You mentioned for those that are listening and you're like, what is pre-contemplation? Give us an idea of what's happening that pre-contemplation stage and how the typical, and we're going to make this very vague because it can, but what does that typically look like for somebody
I
in
would
a
say
relation?
in a nutshell, that's the dissatisfaction. That's I am not happy. I don't know what I'm gonna do about it yet. I don't know how I'm gonna handle this yet, but I don't like this situation and I'm not happy. Contemplative is more about like, what do I need to do about it? I need to start implementing some things. And then you change. And then change happens. And you're like, now we're separated. So before you actually separate, there's a phase of thinking about it, contemplating it, going like, huh. But before that phase, there's a phase of I'm not happy. This is not good for me. This is not, I am not like recognizing I am not satisfied with my life.
When I
And
think that takes a lot
that
of awareness, right?
it does, which is why a lot of people may miss that phase, right? Like
Right.
they're they're just coping, dealing, gritting their teeth, doing what they got to do, going through the motions. That phase.
Yeah.
That's not healthy. That's not how we want to show how to let me have the healthiest relationship. It's called grit your teeth and go through the motion. No. That's that's not what you want for your children. So even then, but like and I know that there's a lot of things that influence someone's point of view. There could be substances, stress, depression, ADHD. I can't tell you how many couples untreated ADHD was a big factor in relationship satisfaction. So, untreated disorders, depression, your own stress from childhood stress, like that's getting triggered by your partner. Like, there's so many factors. And so here you are in this, like, I don't think I'm happy. That would be a time. That would be a time to reach out and figure out because you are also not clear. You don't have clarity.
Right.
So
And
getting
so,
is big.
yes. Yeah, getting clarity. So that in of itself, I mean, we're going to talk about divorce, but I really want to highlight this for a minute because getting clarity is so important. So if you're asking yourself, I'm not really happy, I'm not really sure why, that is, and I'm obviously,
Or
Dr. Donna
you're
and I are going to be
blaming
huge.
because of them, because of them, because of them. Even
Yes,
that.
check in with the blaming. Yes, because if you're not happy, but you're blaming, something still isn't right. And I have on mymentalsummit.com, there's a ton of resources on there of how to access a therapist. That would be a great
Yeah.
stepping stone.
Please.
Doctor, yes, check in with yourself, right? She just said something that I really want to highlight is untreated mental health diagnoses. And even when we're talking about ADHD, right? Like there's a ton of stigmas around ADHD and I think it's thrown around very loosely. Like we all have ADHD. But if we really look at it and slow down for a second on the clinical side of why a high conflict divorce specialist would come in and say, I have so many clients that come in and one or both of the parties are undiagnosed ADHD. Why would that be? Why would that be an area for, you know, somebody to start to check in on to help their
Oh,
relationship?
so I'll tell you right off the bat, untreated ADHD, and ADHD is very stress related. So the more stressed out you are, the worse your symptoms are. Okay. But the thing the brain does when it's stressing, and untreated ADHD brain does when it's stressing, is it intensifies negative thoughts, right? So you will be picking apart your partner, like the criticisms, the negative, like, oh my gosh, I can't believe they're doing this. Oh my God, I hate it when they do that. And then another symptom, ruminating. So you take that negative thought, and then your brain is like, I can't believe they did that. I hate when they do that. They just I can't stand it when they do that all day long. You are going to
Yeah,
hate that. And it
right.
was an ADHD symptom. That was an ADHD symptom that your brain picked a negative thought, ruminated on it, made you into like super irritated and annoyed. Now you think it's because of your partner when really it was your untreated symptom.
Yeah. And we can put that in the category of depression, right?
Absolutely.
Those, like if we're not happy, if we're in a space of unhappiness in general, the spotlight is there and it's hard to move it, especially clinical depression when that unhappiness is we can't find joy in much else. It's going to be really hard to be able to work on your relationship because it's really hard to even work on yourself if depression is there, if anxiety is there, right? Like that anxiety is going to perpetuate, and she just took it, a level higher and said, okay, ADHD has that component of anxiety, and when stress is there, it's going to highlight it, and that spotlight is going to be hard to move on your own, which is, a huge reason that we're having this conversation is because you don't have to do it alone. And so we've talked about these really early stages. We've peppered in some of those, like, hey, don't do this alone. There's a ton of support out there. There's specialists out there.
And
Start to work on
don't make
you.
a decision. Don't say that's it. I'm going to get a divorce. I wouldn't even make that decision without clarity. You need to get
Mm,
clarity. You need to be in a good place to know, is this an accurate decision or is this an untreated, stress related, childhood trauma triggered decision? Like, don't make a
so,
life decision without clarity. That's why you go to counseling. That's why you go to therapies, just to get some clarity. And really, it only takes a couple of months. It's not going to take you years. It's take a couple of
yes.
months, and
And
you're going
and
to be
that's
able to
the
live
thing.
with it.
Yes, to be more clear. And I think that that is something, to highlight there. I think that that's oftentimes another kind of a little stigma. I guess not little, it's pretty big that, and there are therapists out there. Don't let me, I want to validate other people's experience here. We don't want to keep you in therapy forever. Good therapists want to work on your problem. And then, you know what? If you want to dive deeper and you tell me, hey, Megan, this feels good. I'm able to handle this relationship now without all of this stress because I was able to clear up this trauma. But you know what? This is coming up. Then, you know what? We'll continue to work on that. If you're coming in for therapy and you want to handle a specific situation like we just talked about, I want to get clarity. I don't know what direction to take. I don't know where this is coming from. We're going to work on that presenting problem. And then if you're like, I'm good, I've got this, that is our hope, is that we can help. We don't want to keep you here forever. But if you want to dive deeper, we got you. So be mindful that this doesn't have to be a forever thing and the stigma is not there. Break that stigma for yourself, right? To be able to say, this is somebody who has a specialty who can help me think outside of what box this is, who can possibly give me a diagnosis that I'm not even thinking about. How about if I rule that stuff out so that I can manage my life in a happier space, in a more manageable way? That is my hope. And I think that that's Dr. Donna
That
Wilbur's hope.
that's when we know we did good, is you don't need us
Yeah.
anymore. You're good. So
Yes.
usually that's our goal, is to get you to a place where you don't need us anymore. But I use the car mechanic analogy all the time. I go, your car's running badly. You don't wait till it's dead. You bring it in, you're like, it's making a funny sound. I think I need to bring it to the mechanic. Take it to the mechanic. They fix the problem. You're good to go. Something else goes wrong later. You take it to the same mechanic because they know your car. You bring it in. You don't have to like go for years and take your car to the mechanic every week. You can take it when it has having a problem. You can take it for a routine oil change. Just check it in, see if we're doing good. Like,
Yeah.
it's just like a car mechanic thing. But you'll do this for your car. You will do this routine stuff for your car and you won't wait till your car is exploded to bring it to the mechanic. You'll bring it in when it's making a weird sound, but you won't do this for yourself, for your
Yes,
own
yeah.
self.
So let's say, yeah, and I love that analogy because it's so important, right? Like we often say, even as therapists, we're like, oh, I feel on E. Like there's never a time that my cell phone is like in the red. Like I go charge it, I go do all the things. So like I
Right?
often use that analogy. So I love,
Running your
the
car with
mechanic.
no oil or something, like, you don't do that.
Right. And so let's say, for instance, another question that I've been asked is, you know what? I did go too long. There was all the check engine lights on, super unhealthy relationships, right? Um, and now I'm in a space and I'm not sure what to do, but it's nasty. And we've already filed for divorce and we're having a hard time co-parenting. We're having a hard time getting along. What are some of the directions and some of the tools? This is an oversight, y'all. We're not going to fix anything today.
Right.
just just to give you all an insight, but a starting point. Where would we
Well,
go
I
from
I would
here?
say it depends, like, if in they're the same house or 2 separate houses, because these would be, like, 2 different protocols. But,
Yeah.
um, if you already know that you're getting a divorce and you've started the process, it doesn't need to be uglier. So it doesn't you don't need to have more conflict. Um, it depends on where the kids are at, like, if they know, if they don't know. So I call a lot of what I do is divorce coaching, where it's, hopefully the earlier the better, where it's how to communicate, how to set boundaries, how to exist in the home at the same time. So many people have to be in the home during the divorce process because they don't know who gets the house or whatever. How to exist in the home with low conflict because your kids are in the home. Some people do what's called nesting, bird nesting, which it's you try to separate as if you're following a custody schedule where one party is in the home and the other party leaves the home. The kids are still in the same home and you just kind of take turns taking care of the kids. There's a book, it's cooperative parenting, that it's like a whole training course. But one thing they talk about is really recognizing, um, changing your style of getting your needs met. That when you're going to get a
Mm,
divorce, this person no longer should be responsible for meeting your needs, like your emotional needs. So you don't vent to them anymore. You don't share your personal information anymore. This is for your friends now, not for your co-parent.
mm,
You don't like really ask for help from them because you want to be more independent versus dependent on your co-parent. And so you kind of have to all these little fine lights, like, can you change a light bulb? No, you should be doing that yourself, right? Don't rely on your co-parent for your personal needs. Don't vent
yeah.
to them when you come home from work. Like, we have to start snipping little threads of connection, because in the end you want to exist as it's more a professional relationship. Co-parenting is a professional relationship. It's like being two coaches of the same team. You're co-coaches. You're not interpersonal, you're not friends, you're just two coaches of the same team. We have to get this team to the goal, which is healthy, successful adults. And so we're both coaches of this team. We need to be on the same page when it comes to coaching the team. But you don't need to know about my personal life, who my friends are. I don't need to know about your personal life and who your friends are. We just need to be on the same page around coaching the team. So
Hmm.
you kind of have to change the communication, the information sharing, the relying, the connection, all those things have to be kind of changed because the
Yeah.
relationship has to change.
And now that's almost in that almost perfect world scenario, right? That you mentioned if two parents are emotionally stable enough, mental health stable enough to be able to manage it in that way. What do we what would you tell someone who is managing all the things and trying to keep their mental health together, or trying to keep the mental health of the kids together if one of the parties are not able to keep that stability?
Right. So and this happens. And
Right.
so you can't tell your co-parent how to parent.
Mm,
You're not I have this big rule with co-parents. It's no criticizing, no correcting, no giving unasked for advice,
mm,
because those things are considered instigating conflict. That's called picking a fight. Criticizing, correcting, and unasked for advice to your co-parent, you are picking a fight. And that's not healthy to do for your children because I call it poking the bear who is taking care of your children. You want to poke the bear that's taking care of your children, make it angry while it's taking care of your children. That is not healthy for your children. So, if there's a way to we minimize that, like really, it's not healthy in any situation to criticize, correct, or give unasked for advice. But especially in a co-parent situation, it really lights a fire. So we
Yeah.
don't do that, right? If you have concerns about your co-parent's parenting, then go to family therapy, go co-parent coaching, get a third party to step in there and go, let me give you guys some advice on how to coach, how to co-parent, or and how to parent your children. And as a person who does high conflict cases, I separate that. I'll give you your coaching on how to parent in your home, and then I'll give your co parent coaching on how to parent in their home. But I'm not going to be criticizing you with the co parent right there. And I'm not going to do the same
Right.
for them because that just adds to the fight, right?
Mhm.
But if you have concerns, I go bring it to the third party, bring it to the third party. Any kind of family therapist can help the family system. And if you have concerns about your child, do not go vigilante. Do not go rogue and go, I'm going to tell them how to parent this. No, go to the third party. Let us tell them. We don't have a personal relationship with them that's going to get them all triggered. We are a professional and we can phrase that in certain ways that doesn't trigger your co-parent. Okay.
Yeah. We're also not here to tell you what to do. We're here to
No.
guide the tools,
You can
right?
go,
And
I
that's
think this is what's best. Or, from my
mhm.
opinion and research based, this tends to be best for kids. But it's up to you as parents, and you can deviate from that. Unless it's a safety concern or an abusive concern, we we can't micromanage parents.
Yeah. And so when you talk about those safety concerns, because, I've had a lot of, people come to me talking about the other party or whatever it may be, that there is some mental health concerns. And, we're, as therapists, we're not going to diagnose another partner. They're not our client. And so, how, what are some of those red flags that you would say, keep in mind of this? And here's some steps that you can take to manage if you're in a relationship with someone that you have concerns that there's mental health issues. What would be some guidance for them?
Like a big one is substance issues. Like that comes
Mm,
across my path is that a parent will have concern about the other parent's substance abuse issues, like drinking or drugs or something like that. And those are valid concerns. So once again, you can't go rogue and be like, I'm going to drug test you. And, you can't do that. You can obviously call CPS if you think the children are in unsafe situation when they're not in your care. If they're unsafe, you can call and have CPS look into it. But let's say you have concerns about that other parent's abilities. I would say honestly, it justify bringing kids into a third party. I think a third party has to be in there. I really, really do not advise parents to take correcting this situation in their own hands.
yeah.
This is best for a third party. And we document, like, third party would be, let's say, working with the kids, or the kids are stressed because of divorce and we think it's best they have some therapy. Okay, great. Then the child's coming in reporting, yeah, my dad drank 12 packs of beer, or my mom is in the bedroom smoking marijuana all the time. And then you're like, okay, little concerns. So we assess these things. We're like, let me see if this is a valid concern, or let me be the one to report it if it needs to be reported, or, coach a parent. Maybe it's not a serious concern, but maybe it's something we need to coach that parent. Like, really, I don't think any level of intoxication when caring for your child is okay. So I'll be like, can you, consider this? It's not illegal to have a couple of beers while you're caring for your child, but if you're passed out on the couch, that's going to be a concern. So I would say if you have a third party in the picture, delegate to the third party, share your concerns with them. The kid said this, the kid said that. But I'm going to tell you something, and I just came across this, and this is a big deal in really any kind of divorce case, any kind of, not even divorce, because sometimes custody cases, they were never married. So
Right.
in any kind of split custody case, there's a phenomena that a child does. So children want to be loved. Children want comfort. Okay. Instinctively, automatically will do things to get love and comfort. If that child shares with you something negative about your co parent and you respond with pity and comfort, which is our normal automatic response, they say, "Oh, my parent yelled at me and they were mean to me and I cried." And then you're going to be like, "Oh, my poor baby. Let me hug you, my poor thing." That child just did this little connection in their head is when I share information like this, I get connection and comfort. Now, they're not logically, consciously doing this, but
And
they're
and then
programmed.
sometimes that's hard, right? Because
Oh
a
my,
lot oftentimes we hear my kids trying to manipulate the situation. And yes, that could be something
it's
assessed
okay.
for.
That's normal too. But yes, like you said, that's what the third party is there for because we can assess it. We can think about like, is this child doing this for comfort? Is this a valid concern? Is this something that I need to attend to? Let us assess it. But I tell parents, like, be very careful about the level of pity you give to your child when it comes to their co parent. Like rescuing your child from the other parent, like, "Oh, I need to rescue you. My poor baby is with someone so terrible and mean." That is giving the child the impression that they're not safe over there, that that parent is a bad person, and you're just going to increase their level of stress. You're setting them up to go into that household. If this was school, you're going to be like, "Oh, my poor child, your teacher's really mean and they yell and scream and they're going to hit you. Here you go. Have a good day." Yeah, they're gonna
Yeah.
be like, "What are you doing?" But if you're like, "You know what, it's okay, and I'll keep an eye, and I will make sure everything's are fine, and I'll have someone talk to that teacher and make sure, like, you reassure them, and you don't go like, 'Oh, my poor baby, how terrible, horrible,' and go again tomorrow." Your child's gonna be like,
So,
"A, what are you doing? This person is
yeah.
terrible, and B, what kind of parent are you that's sending me into this situation?"
So, I mean, we could be talking a lot about a lot of different dynamics that can be happening just simply by the way that I think instinctually I want to respond, right? As a parent, if my child is going through a difficult time, I want to comfort them. I want to give them the affection and love. But so you're telling me, if my child's coming to me having this difficult time at the other parent's house, to just check in with my response first, continue the reassurance, continue the validation, and know that you're continuing to monitor as the other parent, and that, like, what other tip would you add in there, especially if it is a difficult situation, but maybe that parent's relearning how to use some of the skills by themselves or learning for the first time. A lot of parents come to us and they're like, "Oh, I can't do this." Like, I mean,
Right?
that's how my parents
But they're
did
not
this. And
trained. They don't have all this education that we have, differentiating pity from support, okay?
there you go.
Pity
Yeah.
looks like one thing, victimizing, okay? Victimizing your child looks like one thing. Supporting your child looks like another, okay? We wanna encourage them to that they can handle things, like, "You're strong, you have coping skills, let's use them." Sharing with me, talking about it, I'm validating, I hear you, like, that's support. Victimizing and pity is actually setting your child up for depression and anxiety, okay? And we
Hmm.
know this. We're therapists. We don't victimize people. When they come in and go, "Oh, my horrible, terrible situation," we don't go, "Oh, that's so terrible. Everything's terrible." We go, "I hear you, and it's rough. And so what do we need to do to help you cope with that?"
Yeah.
Okay.
Well, and here's something really important that you just said too, because oftentimes, I mean, even as therapists, right? I have therapists that are going through divorce. I have therapists who have been through it and didn't handle it the best because you know what? Although we're trained in this, when stress hits, it could be hard for us, even as people, to access those skills. And so
Right.
I just want to like break those stigmas and humanize it even more so that when stress is high, sometimes even as professionals, sometimes we don't access all the tools. Sometimes they drop to the back of the toolbox and we're like, I know it's there. I don't even know because my stress is so high. And so give yourself that permission to take the pause when the stress is high, right? Have a therapist, therapists have therapists.
Yes, they
And
do.
so even as professionals, I don't, I just wanted to kind of put that asterisk there. I wouldn't want somebody to put us always on that pedestal because when you're in a stressful situation, I've had genius, emotionally genius humans that get in that stressful environment and in a situation that they thought they would never be in, right? I mean, most people do not get into situations or marriages thinking that they're going to have a divorce, right? Like that wasn't the intention and life happens. And so when the stress is high or the tools haven't been there before, it's okay, like you said, to go get that oil check because sometimes that stress just makes us forget all of those tools in there at the bottom of that toolbox and we just need some support. So, to kind of mention what you had mentioned before is that sometimes it's not the divorce that causes the trauma. It's actually how it's managed after and how the parent manages their own stress. So, talking on that note, going through separation, divorce, a legal situation, even, parents who are trying to just manage it between the other person without high conflict. What are some of the tools when you think about managing your own mental health, and why is it so important for the adults to actually take the time on themselves to show up bigger for the kids over time? Like, how do they manage their mental health through this?
So I would say like some of the best tips for people going through this, like this is a really stressful situation. One of the most stressful that anyone may go through in their entire life is a divorce or a high conflict divorce. Like there's so much court involvement, there's so much stress with parent interactions that it takes a toll. So that self-care and the way I think about it is like the healthier you are, the better a parent you can be. The
Mm.
more you manage your stress, the better parent you will be for your kids. So even if it's like, oh, I don't have time, I have to work, I have to do all this. And I understand that. I understand, life comes in and being really busy.
Or people feel selfish, right? I've had so many
Right.
parents that they feel selfish. I feel like I'm
Or the
taking time
kids will
away from
make
my
you feel
kids.
guilty. Like, they will
Yes.
literally go like, "Why do you have to go to the gym?" Or, "Why do you have to do this?" Like, they will make you feel guilty, and that's okay. That's their kids. They're allowed to do that. You don't fall for it. You have to be like, "I need to do this to be the best parent I can be. I need to manage my stress to be the best parent I can be." One of the best ways to handle stressful situations is to reach out to your tribe, to reach out to
Yeah.
your support group, set aside the time. I know it's challenging. Multitask if you have to, so that you can vent and share and talk about this and get it off your chest and not be alone, not feel like it's all you handling it all by yourself. When you reach out for connection and
Yeah.
share with people who are supportive, not people who make you more angry or people who
Well,
make
and I
you
think
more nervous,
and I
people
think that
who
that's
help you.
hard.
It is.
Yes, and I think sometimes that's very hard because divorce has such high stigma attached to it, and the generation change has shifted so much. And so, or you have religious, I mean, there's so many reasons that divorce in and of itself can make you feel like you have zero tribe. And sometimes I've seen it actually quite a bit where separation or divorce, you are by yourself all of a sudden. nobody can understand, nobody's there to support you, or I mean, it's so scary for them that they don't know how to show up for you. And so even for those that, as soon as you said, reach out to your tribe is one of the most important things. What do they do when there's zero tribe?
Hey,
Yeah.
it's us. We're your tribe.
Hire your tribe.
Yeah. That's if you don't have anybody, we're professional support people. Like we will be there for you. We will be your tribe and we will help you create and find a new tribe.
Exactly. And there's nothing wrong with hiring your tribe because it will be temporary to get you through one of the most challenging times in your life. In order to find if you need a new tribe, then we help support you as you are
Abs-
uncomfortable making friends in adulthood and, or starting to date again or, starting to form new relationships again. I mean, it's hard and it's okay to hire your people until you find your new tribe. And so when we talk about the self-care, oftentimes I hear it's selfish that we have all those stigmas involved in it and take it as cliche as you need, but taking that time for you to heal is so important because you're going to show up bigger for the kids and then bigger for yourself as you heal through that
That
process.
is the most valuable gift you can give your kids is you regulated. You with a calm nervous system is the best gift you can give these kids. And the most influential characteristic that influences your child's well being is your nervous system.
Mm. The most influential gift you can give your kids is a calm nervous system. Your words are way prettier, but I had to highlight that.
No,
It is so
that it
important.
influences your child's well-being, that influences their nervous system, it influences their brain development, it influences their attachment system. Your you in a calm place is the healthiest thing you can do for your child, healthier than sports, education, like whatever. I don't care what you're doing, vitamins, diet. Your calm nervous system is the most influential factor in their well-being, the most. And if you're
Because
going to neglect that, then your child don't get that. And that's
Because what do we see happen? I mean, give us a scenario that throws it out of whack when as a parent you don't have that calm nervous
if
system
you didn't
reacting.
take the time, even like a 5-minute breath video or meditation in the car before you go into the house or before you pick up the kids, even 5 to 10 minutes changes your whole disposition. When you're stressed, you do not attach and bond. You're distracted, thinking about other things, and your child does not feel the attachment with you. When you're stressed, you are irritable, you're annoyed, you're impatient. And that child needs your understanding. Okay. When you're stressed, you're dissociating. You're not present. You're not right there connecting with your child. You're just mentally over here. And your
And you know
child
what?
knows that.
They feel it. And you know what? You are, for the most part, most of us that are like, oh, I do that. If you are like trying to shame yourself right now, throw it away because you know what? It's the best tool that you know that you have right
Just
now.
take a breath. Like, take a
But
breath.
reel it back. Yes, some
This is
deep
to fix
breathing.
it, not to shame. This is awareness so you can change it. This
That's
is
it.
not a shame thing. I
Mm.
understand it happens. And this is just, yeah, it happens. So let's fix it.
And there's tools out there, right? You said take 5 minutes in the car before you run in the house or before you pick up the kids or before you could do the drop, whatever it may be. Take those few minutes to yourself because look at all the things that you gain back and all the things you could be missing if you don't do it and learn and teach your nervous system how to regulate. There are tools, right? I often hear like I feel broken. I go from 0 to 10, there's no in between and then I can't shut it off. You're not broken, you just don't
You're
know
stressing.
yet.
This where your baseline is up here. It gives you
Yeah.
this much room before you lose it. If your baseline is down here, look at all this room you have. to, to handle situations. But another
Yeah,
thing too, your nervous system, your child's nervous system will match it. And if you're
co-regulating.
stressing, whether you like it or think it, or you can't fake it. You can't go like, oh no, I'm calm and relaxed and internally be stressing out. It doesn't matter what you're saying or doing. Your child's nervous system will match your nervous system. And if that child is going to be stressing because you're stressing, if that child's doing that chronically all the time, you're affecting brain development, you're affecting their body development, you're affecting their whole well-being. So it's like crucial. So you want to
Yeah.
say, "Oh, I don't have time for me." This is crucial. This is like,
Yeah.
"Oh, the house is on fire. I don't have time to find a hose." Like, no,
It's
you
like
need to
there.
do this
Yes.
like now.
Yes. And that comes to kind of like rewind what you said, that comes with a lot of awareness, right? Like, oh, I didn't know that I was even doing this, right? Like I thought that I could be, what is that analogy? Like the duck in the water and my
Right,
feet are just going, but you're going to see me nice, calm, cool, and collected. But
right.
what you're saying right now is that the kids feel it because there
Yes,
is that intrinsic connection that kids have to, especially to their natural parent, to their birth parent, and thankfully they do get attachment when other relationships are formed and the parent brings another person into that, and teaching how to model that is so important. So as I touch base on that, within family dynamics that are kind of coming together with different systems, what what would you say is a really great tool to be mindful of when you're bringing in another person into the family, and you've separated, maybe it's going smooth, but then like the parent marries somebody else or the parent starts to date again? What are some things to be really mindful of to help that be as smooth as possible for yourself and for the kids involved?
I would say there's two things that come to mind. The first is the more people that love your child, the better. Okay. So if there's new people being brought into the picture, as long as they are kind and loving to your child, value them. Like, yay. Because the more people that love your child, the more people that support your child, the better. You don't want to be like, oh, I don't like that person. So I don't want them to love you and support you. And I don't want you to love them back. Like that doesn't make any sense to me. So if there's other people being brought in the picture, kind and loving, that's what matters. Let your child love them, let them love your child. The other thing is anytime you bring someone else into the picture, a new person in the picture, do not put them in the position of parent. Do not let them take the position of parent. That is a different bond, and it can actually sabotage their relationship with your child if they take on that position, or if you put them in that position, that can sabotage their relationship with your child. And that will make then your child not attached to them in the healthiest, most positive way that they can. So the saying in this field is natural parents natural. So the bio parent, the natural parent does all the correcting, the criticizing, the disciplining, the consequences, the lectures. Only the natural parent does that. The
Mm.
the new person, they should defer to you, and you do not even let them. They're like, I got this. I'm the parent. I got this. I'll handle this. Okay.
Well, and
So,
would that take some time if that dynamic needs to happen, or if the natural parent isn't doesn't naturally go in that direction? Would that take time to form what would be considered that, I guess, that unit of both parents taking on that role?
so really it's the younger the child, the more they can handle someone else acting like a parent.
Mm,
So if the child's like under 5, usually they'll adapt. Like, this is an adult. I guess they're my parent too. Like, they're going to be talking to me like a parent. Like, they can almost like adapt to the situation. But the older the child is, the more they have bonded with their natural parent, and the less they will be able to tolerate criticism and discipline and authoritative tones from other people. So It's kinda it depends on how old the child is how much they can handle about that new person being in that authoritative role.
And I think that that's an important part there, and something to tie back into what we were mentioning is oftentimes this does take a bit of work around,
Mhm.
because if there was healthy bonding, right,
Right.
there's oftentimes, and this is why I will say, go to an expert on this, because if you're trying to break some generational, healthy bonding, and you're not sure what that looks like, and maybe you've had the relationship that wasn't very healthy, and now you're trying to rework that healthy bonding. This is again why we would say, you don't have to do it alone. And so, for those getting out of those really unhealthy relationships and really trying to work on new relationship forms, what is and again, big umbrella here, but what would you say to that person that's like, wow, I didn't even realize how unhealthy that relationship was until I'm no longer in that relationship?
I would say, like, no matter what, give yourself probably a year to heal and recover and
Mm,
reboot. Otherwise, you're probably gonna pick someone similar, not consciously, or you're gonna be, that rebound relationship is not a fiction. It is true. People do get in rebound relationships. So if you're getting out of a really unhealthy relationship and you want to have a healthy relationship in the future, you want to really work on those characteristics that contributed to you even being in an unhealthy relationship. You want to resolve those things. And I have to tell you, a lot of them are childhood trauma based. Is
mm,
you really want to do some trauma work, resolve things, realize what your coping mechanisms were, realize what your triggers were, get into a healthy place where those are no longer driving you, and then pick a
yeah,
partner. And then go
I
out,
love
go
that.
shopping out there.
Again, do your work, take time for you to heal. And I think that that's been really such a beautiful part about our conversation today, is the importance to take time for you to heal. And that was my, to wrap this up, in the work that you do, what is the one thing that you do for yourself after you close out a tough day? You've got to go to your family, right? What do you do for yourself to help yourself close out after you've given so much to so many? What do you do? What would you
I
say is
do
your?
I do mine more pre-workout versus post-workout, okay? So I really, really get myself prepped for the day. I am not joking. I do restorative stretchy yoga. I do like get all that okay trauma out of my body. I love my breathing videos that I have a whole breathing to calm your nervous system. I take lovely supplements that whatever helps my nervous system heal. I when I have breaks in my day, when you have in the day people don't show up or someone canceled late or whatever, I make those gifts to myself or like little pamper Donna moments. Like I'll go get ice cream or take a walk in a park. I'm like, I am using this time as self-care time. I'm like, the universe gave me a moment. I'm taking the moment. And then at the
Yeah.
end of the day, probably like a lot of other people out there, I go home. I am a late night worker. So I go home, it's probably 9 o'clock, 9:30 at night. And then like people are sleeping already. I'm on there watching Love Island with like a snack and tea and like just zoning out to like I don't even care about nothing, just mindless TV, letting the world go bye-bye. And then I take my magnesium and listen to meditation as I'm going to sleep. Like I work it. Working it.
Yep. So, y'all, she's out there doing the work, but also practicing what
Oh,
she
yeah.
preaches, because it's so important for that nervous system. Donna, I just want to say thank you so much for showing up today. Thank you for giving us some insights. It was so good to chat with you. And any ending notes that you would share? Anything that you feel like I missed?
I think you did really good. I think we got a lot of stuff out there for people who are listening to feel like maybe they get some tools or tips or ideas or whatever. But
Yeah,
just like I'm
that's our
sure with,
hope.
with you and with me, I'm a talker. I want to help. So even if there's like a quick little email or somebody needs like, just a quick idea or a resource, I have no problem talking. Like, I'm not going to be like, oh no, I have to charge you. I'm like, if you're like, can you just give me an article on something? I'll send it to you. I don't care.
Right. If you want to do that work, you guys, most therapists are going to show up for you and give you a resource. Um, Thank you again. Thanks for this niche. I know how much it's needed, and I hope you have a beautiful rest of your day.
Thank you for having me and talking about this. You're so valuable.
You too. Thank you. Thank you so much for listening today. I hope you gained what you needed to hear today. Healing isn't about erasing the past, it's about the strength of moving forward. If today's episode resonated with you, take a moment to share it with someone you love, because when we share with love, we help to break the stigma together. If you want to connect with me and learn more about what we're doing over at Mental Summit to break these stigmas, please connect with me over at mymentalsummit.com. Keep showing up, keep growing, keep going together, and remember, you're not alone in this.